All right, so you sent over a really interesting stack of research articles and guidelines all about testosterone deficiency. Looks like we're diving deep into this. We've got guidelines from both the American Urological Association, the AUA,
Oh,
and the Endocrine Society, plus a handful of research papers that caught my eye.
yeah. It's definitely a topic that needs some clarity, I think,
Yeah.
with all the conflicting information out there.
Absolutely. And that's our mission today, to navigate all the complexities of diagnosing and managing testosterone deficiency, separating fact from fiction, highlighting some of those surprising details you might not expect.
Right.
Like, for starters, what does low T actually even mean?
Right.
You might think it's simple, just checking your testosterone level.
Yeah.
Turns out it's not that straightforward.
No, it's definitely not that simple. Um, you can't just look at a number
Right.
on a lab report and make a diagnosis. Both the AUA and Endocrine Society guidelines are very clear on this. A true diagnosis of testosterone deficiency requires consistently low testosterone
Okay.
and the presence of symptoms.
So it's kind of like having all the ingredients for a cake,
Right.
but you still need a recipe to put it all together.
Exactly. Yeah.
So what are some of those telltale symptoms we should be looking out for?
Well, the one that's always talked about is low libido,
Yeah.
reduced sexual desire. But it can go way beyond that.
Oh,
You can have fatigue, difficulty building muscle mass, um, even changes in mood and bone density.
wow. I had no idea. It could impact so many different things.
Yeah,
I can see why a thorough assessment is crucial, not just a quick blood test.
absolutely. And that's what the guidelines really stress.
Yeah.
Your doctor needs to take a detailed medical history, do a physical exam,
Mm.
and really consider your individual circumstances.
Yeah.
It's about connecting the dots
Yeah.
between your lab results and your actual experience.
So, okay, before we jump into treatment, let's back up to the lab tests themselves. One thing that really surprised me was the variability in how testosterone is actually measured.
Mm-hmm.
Apparently, what's considered low in one lab could be normal in another.
Yeah, that's true.
That seems like a recipe for confusion.
It definitely adds another layer of complexity.
Yeah.
And the AUA guideline actually goes into this in detail. You see, there are different methods used to analyze testosterone levels
Hmm.
in a blood sample. Some are more accurate and reliable than others.
Got it.
Like, for example, liquid chromatography, tandem mass spectrometry, LCMS.
LCMS.
Yeah, it's considered the gold standard.
Sounds pretty high tech.
It is.
But even with the most accurate methods, there's still room for variation.
Unfortunately, yes. Each lab establishes its own reference ranges,
Oh.
which can depend on the population they're testing and the statistical methods they use.
Mm.
So the absolute value of your testosterone level is what really matters,
Okay.
not just whether it falls within a particular lab's normal range.
So it's not as simple as just comparing your results to a generic chart.
Right.
You need to consider the specifics of the test and your individual situation. Really highlights the importance of having a knowledgeable doctor
Yeah,
who can interpret those results accurately.
absolutely. And speaking of doctors, who should actually get their testosterone levels checked,
Yeah.
you might assume it's only for men who are experiencing those classic symptoms.
Yeah.
But the guidelines suggest considering a test even without those symptoms if you have certain conditions.
Oh, interesting. What kind of conditions are we talking about?
Things like unexplained anemia, low bone density, even diabetes, and exposure to certain treatments like chemo or radiation.
Oh, wow. So there's a potential link between these conditions and low T.
There is. Testosterone actually plays a role in a lot of different bodily functions, from red blood cell production to bone health, to insulin sensitivity. So low testosterone can either be a contributing factor to those conditions or it can be a consequence.
Makes sense.
Mhm.
So if you have any of these conditions, it's worth discussing with your doctor whether a test is appropriate. Early detection and treatment could be beneficial in those cases.
Exactly. And remember, it's not just about the total testosterone level.
Right.
We also need to talk about the different types of testosterone in your body and why that distinction is crucial for understanding how it all works.
Okay, let's unpack that. I've heard about total testosterone and free testosterone, but I'm not quite sure what the difference is. What's the significance of that distinction?
That's a great question. And it's really key to understanding how testosterone actually functions in your body. Most of the testosterone in your bloodstream is actually bound to proteins,
Okay.
primarily one called sex hormone binding globulin, or SHBG for short.
SHBG.
Yes. And this bound testosterone kind of acts as a reservoir, while a small percentage, usually around 2%, circulates freely.
So it's kind of like having a savings account and some pocket money.
I like that.
The bound testosterone is stored away, and the free testosterone is ready to spend.
Exactly. And it's that free testosterone that's considered biologically active, meaning it can actually interact with cells and do its job.
So if someone has low total testosterone, but their free testosterone is normal, does that mean they're not actually deficient? It's possible. There's a theory called the free hormone hypothesis. It suggests that the biological effects of a hormone are mainly driven by the concentration of its free, unbound form. It's like having enough pocket money, even if your savings account is a little low.
Okay, this is where things get really interesting.
Right.
So how do we figure out if someone's free testosterone is actually low? Is there a specific test for that?
There are a couple ways to approach this. The most accurate method is a direct measurement called equilibrium dialysis,
Okay.
but it's not always readily available. So the other option is to actually estimate free testosterone based on your total testosterone, SHBG, and albumin levels using a mathematical formula.
Ah, so they're using those values to sort of deduce how much free testosterone is likely floating around?
Exactly. There's several formulas out there, but the accuracy can vary. It's important to use one that's been validated against those direct equilibrium dialysis results. Wow, this is a lot more nuanced than I initially thought. It seems like understanding these details is crucial for getting a truly accurate picture of your testosterone levels.
You're absolutely right. And once you have that clear picture, you can start to explore the various treatment options, which is a whole other deep dive in itself. But let's save that for part 2 of our discussion.
Okay, sounds good. All right, so we've laid the groundwork for understanding what testosterone deficiency is, how it's diagnosed, and why those numbers on your lab report aren't always so simple.
Right.
Now comes the part I'm really excited for, diving into treatment options.
Yes, let's explore the toolkit.
Yeah.
And you might be surprised at just how many options are available.
It is kind of mind-blowing when you realize just how many different approaches there are. We're talking gels, creams, patches, injections, even pellets.
Exactly. And the AUA guideline actually goes a step further and lists specific brand names.
Oh, wow.
Which I thought was really interesting because it highlights that each product has its own unique characteristics.
Right, like delivery methods, dosages, and how it impacts your body.
Right.
So it's not one size fits all.
Not at all.
So let's break it down. Starting with the options that I feel like I hear about most often, gels and creams.
Yeah.
What's the deal with those?
So gels and creams are popular because they're generally easy to use.
Okay.
They're absorbed through your skin and provide a steady release of testosterone over time.
But there's that whole concern about transferring testosterone to others through skin contact, right? I remember reading something about that in the guidelines.
Yeah, that's a valid concern, particularly for men who live with women or children.
Right.
The guidelines really emphasize the importance of washing your hands thoroughly after applying the gel or cream and covering the application site with clothing to minimize that risk of accidental exposure.
Makes sense. Okay, so what about patches? Are those similar but less messy?
Yeah, patches work in a similar way. They release testosterone through the skin. They tend to be less messy than gels or creams, but they do have their own considerations. Like some people experience skin irritation from the adhesive.
Interesting. So it's all about finding what works best for your skin and lifestyle. Now, injections, I have to admit, those make me a little squeamish.
I understand.
But I know they're a pretty common option. But what's the advantage of going that route?
I understand. Needles aren't everyone's cup of tea, but injections offer a distinct advantage. They deliver a higher dose of testosterone less frequently.
So fewer trips to the doctor's office or less frequent self-administration.
Right.
That could be a big plus for some people. And are there different types of injections?
Yeah, you're right. It's not just one type. There are short-acting injections, which are usually given every 1 to 2 weeks. And then there are long-acting injections that can last for several months.
Okay.
So it depends on your preference and how your body responds.
Got it. So we've covered gels, creams, patches, injections. Now, those pellets you mentioned,
Yes.
those sound pretty intriguing.
They are pretty interesting.
How do those work?
So pellets are tiny implants, about the size of a grain of rice, that are inserted under your skin. And they release testosterone continuously for several months.
So kind of like a long-acting injection, but without the need for repeated shots.
Exactly. However, they do require a minor surgical procedure to insert and remove.
So it's about weighing the convenience factor against the invasiveness of the procedure.
Right. And we also have buccal tablets
Oh.
and nasal gels, which offer even more specialized delivery methods.
Buccal tablets, I'm not familiar with those. Where do those go?
They're placed between your gum and cheek,
Oh, okay.
and they release testosterone that's absorbed through the mucous membrane.
Oh, wow.
And nasal gels, as the name suggests, are applied inside your nostrils.
So they kind of bypass the digestive system and go straight into the bloodstream.
Exactly. But they can have some potential drawbacks, like gum irritation or nasal congestion. So it's all about weighing those pros and cons.
Wow, so many options to consider. It seems like the key is to have that really open and honest conversation with your doctor
Absolutely.
about your needs, preferences, and concerns. They can help you navigate this whole maze and find the right approach for you.
Absolutely. That personalized approach is crucial. And speaking of conversations with your doctor, let's address the elephant in the room, the risks and controversies surrounding testosterone therapy. I know there's been a lot of back and forth about potential links to heart problems and prostate cancer.
Right, I've seen those headlines. And it can feel overwhelming. Trying to sort through all the conflicting information out there. What does the research actually say about these risks?
Let's start with a heart health question. The research here is complex, with some studies suggesting a link between testosterone therapy and an increased risk of heart attack or stroke, while others find no association, or even a potential benefit.
So it's not a clear-cut answer. What do the guidelines recommend in light of this uncertainty?
Both the AUA and Endocrine Society guidelines stress the importance of carefully assessing cardiovascular risk factors before starting testosterone therapy, and then closely monitoring patients throughout treatment.
So it's about individualizing the approach and proceeding with caution. What about those studies that showed a potential benefit for heart health?
Yeah, so some studies have shown that testosterone therapy may improve certain markers of cardiovascular health, like blood vessel function and cholesterol levels. However, more research is needed to confirm these findings and determine whether they translate into actual reductions in heart attacks or strokes.
So it's a promising area, but we need more data.
Right.
What about the research on prostate cancer?
Yeah.
That's a major concern for a lot of men, considering testosterone therapy.
It's definitely a topic that warrants careful consideration. The AUA guideline specifically states that testosterone therapy in men with testosterone deficiency does not increase the risk of prostate cancer. But it's really important to understand the context of that statement.
Okay, what's the context?
So that statement is based on the currently available evidence, which is mainly from short to medium-term studies. We need more long-term research to really understand the full picture. But it is important to emphasize that men with testosterone deficiency are not at an increased risk of developing prostate cancer
Okay.
compared to men with normal testosterone levels.
That's a key distinction. But what if someone already has prostate cancer? Is testosterone therapy automatically off the table?
Not necessarily. The guidelines actually provide specific recommendations for managing testosterone therapy in men with a history of prostate cancer. So it's a nuanced conversation that needs to happen between the patient and their doctor, taking into account factors like the stage and grade of the cancer, previous treatments, and the individual's risk tolerance.
So it's not a blanket yes or no. It's about personalized decision-making
Exactly.
based on your individual circumstances. But even for men without prostate cancer, I've heard that testosterone therapy can sometimes increase PSA levels, which can be alarming. Is that true?
It is true that testosterone therapy can cause a slight increase in PSA levels,
Okay.
but it's usually not a cause for concern. The key is to monitor those levels closely and understand the context. The guidelines emphasize that a small increase in PSA doesn't necessarily indicate cancer progression.
So it's about tracking the trends and not overreacting to a slight blip.
Right.
Now, I want to touch on something you mentioned earlier, this variability in testosterone levels. Even when someone is on therapy.
Yeah.
Why does that happen? And what can be done to address it?
That's a great question. And it highlights the need for individualized treatment and monitoring. Your body's response to testosterone therapy can be influenced by a lot of factors.
I'll go what?
Well, the type of therapy you're using.
Okay.
Injections tend to cause more fluctuations in testosterone levels compared to gels or patches.
Okay.
But even within a specific type of therapy, you can see variability depending on the product, dosage, series, or frequency of administration.
Yeah.
And then, of course, there are those individual factors we talked about earlier, like your metabolism, absorption rate. Even things like stress and sleep can affect your hormone levels.
Right. It's like trying to solve a multivariable equation.
Exactly. That's why regular monitoring is so crucial, especially in the beginning when you're figuring out the right approach and dosage.
So it's about fine-tuning the treatment to find that sweet spot, where your testosterone levels are consistently within the therapeutic range. What is that therapeutic range? Is there a magic number everyone should be aiming for?
There isn't one-size-fits-all answer, unfortunately. The ideal testosterone level can vary, depending on your age, your health history, your individual response to therapy.
Right.
But the guidelines generally recommend aiming for the mid-normal range for healthy adult men. However, it's not just about hitting a specific number on a lab report. It's really about how you feel, how you're functioning in your daily life.
Right. Those subjective symptoms are just as important as those objective lab results.
Absolutely.
It's about finding what works best for you, not just chasing a number. Before we move on to lifestyle changes, which I definitely want to explore, is there anything else we should mention about the different types of testosterone therapy?
Yes. Actually, there are a few specific risks associated with certain therapies that are worth highlighting. For example, the AUA guideline mentions a boxed warning from the FDA
Oh,
regarding intramuscular testosterone undecanoate. It's a long-acting injection.
a boxed warning. That sounds serious.
Yeah, so there have been cases of serious pulmonary oil microembolism, or POME, and anaphylactic reactions associated with this particular formulation.
Wow.
And because of this, the FDA requires providers to be specially certified to administer this therapy. And patients need to be closely monitored for at least 30 minutes after each injection.
That definitely highlights the importance of understanding the potential risks and benefits of each treatment and making informed decisions with your doctor.
Absolutely.
Yeah.
And it brings us back to that crucial point: open communication and shared decision-making between you and your healthcare provider. Now, speaking of empowering choices, let's shift gears and talk about lifestyle changes. I was really fascinated to learn that things like weight loss and exercise can actually boost your body's natural testosterone production.
Right. So it's not always about reaching for a prescription right away. Sometimes the solution lies in making some positive changes to your daily habits.
Yeah, it's like taking charge of your health from the inside out.
Exactly.
I was reading through the AUA guideline, and they emphasize that lifestyle modifications should be a cornerstone of managing testosterone deficiency.
Absolutely. These changes can be really powerful, whether they're used alone or alongside medication.
Yeah.
In fact, for men who are overweight or obese, the guidelines actually recommend weight loss. Okay.
And lifestyle changes
Yeah.
as the first line of treatment.
It's like addressing the root cause instead of just masking the symptoms.
Exactly.
And the research seems to back this up. I was looking at a meta-analysis that was cited in the guideline, and it showed that losing even a small amount of weight, like 5 to 10%, can actually lead to a significant increase in testosterone levels.
It's remarkable how much of an impact these small changes can have.
Yeah.
And it's not just about shedding pounds.
Right.
Exercise,
Yeah.
particularly resistance training,
Okay.
has been shown to boost testosterone production as well.
So hitting the gym isn't just about building muscles. It could also be helping to rebalance your hormones. I like the sound of that. But I'm curious, are we talking about really intense workouts, or can even moderate exercise make a difference?
Well, while those intense workouts can certainly have an effect, don't underestimate the power of moderate activity.
Okay.
Even something as simple as a brisk walk or a bike ride
Yeah.
can contribute to a healthier hormonal profile.
Got it. So we've got weight loss exercise. What other lifestyle factors should we be paying attention to?
Sleep is a big one. Chronic sleep deprivation can really disrupt your hormones and lead to lower testosterone production.
So getting enough sleep isn't just about feeling refreshed. It's actually crucial for maintaining that hormonal balance.
Exactly. And another often overlooked factor is stress. Chronic stress can actually elevate your cortisol levels, which can then suppress testosterone production.
That makes sense. I know when I'm stressed, I definitely don't feel like my best self. So it's not just about reducing those stressors.
Right.
It's also about finding healthy ways to manage stress.
Exactly. Whether it's through exercise or meditation, spending time in nature, connecting with loved ones, finding what helps you unwind and de-stress is really important.
Okay, so we've covered a lot of ground today. We talked about the complexities of diagnosing testosterone deficiency. We delved into all those different treatment options. We even uncovered the power of lifestyle changes. Before we wrap up, there's one fascinating concept you mentioned at the start that I want to circle back to, this bipolar testosterone concept. What exactly is that, and why is it so intriguing?
That's a great question. So the bipolar testosterone concept is actually a relatively new theory, and it's challenging the traditional view of how testosterone affects prostate cancer. You see, the old thinking was that more testosterone equals more fuel for cancer growth.
Right.
But this new concept suggests that it's not so simple.
Okay, so it's not just a linear relationship.
Exactly. The idea is that prostate cancer cells don't just keep growing endlessly
Okay.
with more testosterone. At a certain point, they may actually reduce their rate of proliferation. It's like they hit a peak and then plateau, almost as if too much testosterone can actually have an inhibitory effect.
Wow, so it's not just about suppressing testosterone at all costs. It's about finding that optimal balance.
Right.
But I imagine this concept is still being researched and debated.
Absolutely. It's a relatively new idea, and
Right.
more research is definitely needed to fully understand its implications. But it does raise some really interesting questions about how we approach prostate cancer treatment and whether there might be a role for personalized testosterone therapy.
Yeah. It's a good reminder that science is constantly evolving, and we need to be open to new perspectives and challenging old assumptions. This has been such an insightful deep dive. I feel like I've gained a much deeper understanding of testosterone deficiency, and I hope our listener has too.
I agree. And I hope they feel empowered to have those conversations with their healthcare providers.
Mm,
You know, be an active participant in their own health journey.
exactly. And remember, this deep dive is just a starting point. There's always more to learn and explore, so keep asking those questions, keep seeking out that knowledge, and keep advocating for your well-being.
And I'll leave you with one last thought to ponder. Even if your testosterone levels fall within that normal range, but you're still experiencing those symptoms, it's worth investigating further.
Yeah.
It might be a sign that something else is going on, and addressing that underlying issue could be the key to really feeling your best.
Such an important reminder. Sometimes the answer isn't as simple as just focusing on one hormone. It's about looking at the bigger picture and considering all the pieces of the puzzle. So thank you for guiding us through this fascinating world of testosterone. And to our listener, we hope you feel empowered to take charge of your health and navigate this complex topic with confidence.